questions about your genes or your DNA. Let's find the answers. Ask a genetic counselor.
Hello, everyone, and welcome back to Ask a Genetic Counselor, the podcast where your genetics questions shape the conversation. I'm your host, licensed genetic counselor Sam Geere. Today, I'm joined by a very special guest, the world's most interesting man of mutations, Dan Drydock Shockley. Dan is a retired Navy veteran and a passionate advocate for hereditary colorectal cancer awareness. He lives with attenuated familial adenoma polyposis, or AFAP, and has spent years educating patients, families, healthcare professionals, and policymakers about hereditary cancer syndromes and the importance of early detection. Dan, thank you so much for joining me today.
Oh, Sam, my pleasure. Thank you for the invitation.
It's really such a pleasure to have you here. And, before we jump in, I just wanted to thank you not only for taking the time to join me today, but just also for your years of advocacy and your service to our country. As I was preparing for this conversation, it really became clear how much time you've dedicated to helping others and just helping people understand hereditary colorectal cancer syndrome. So I'm just really grateful you're willing to share some of your experiences with us today.
Absolutely. Thank you. I appreciate it. I literally and figuratively, I lived for this because if it wasn't for my diagnosis, there was a very good chance that I wouldn't have made it a few more years after my diagnosis. So, but I am here. So, turn a negative into a positive.
It's just really amazing, just this attitude you've had and using this situation, which would be very difficult for anyone, and turning it into that positive and really helping others. And so, I thought we'd answer some of the questions that people who are diagnosed or families of these individuals commonly have after a diagnosis with the hereditary cancer syndrome. And I think there's no one better to answer them than someone who's actually lived it. And so, Dan, I'd really like you to imagine someone listening today who was diagnosed with AFAP maybe just this week. Maybe they're sitting in their car after a doctor's appointment, or they're searching the internet trying to understand what this all means. What's the first thing you'd want this person to know?
Wow. Yeah, that's a great question. Well, what I had done, I recommend or suggest for individuals is have a open discussion with your certified genetic counselor, your GI doctor,
Mhm.
and eventually your colorectal surgeon. Um, get some good resources, credible resources to read. Now, about the mutation, if you have been diagnosed with it or your family members, the type of surgery,
Mhm.
um, and then having a permanent ostomy. So I broke it down into three phases that I wanted to know, read about the mutation. And
Mhm.
I had absolutely no idea what they were talking about. I didn't even,
Uh,
it took me 3 weeks to learn how to say the attenuated familial adenomatous polyposis. I could just roll it right off my tongue now. That's how I pronounce it. There's
mhm.
different medical professionals that pronounce it differently. But
Mhm.
I just wanted to try to read, theory is one thing, practical application is another. So,
Mhm.
the mutation, it took 6 weeks to get the results back. And
Yeah.
then having, once I had the results in, I already set my mind that I wanted to have the total proctocolectomy or permanent ileostomy surgery
Mhm.
because any of those polyps left unattended have a 100% chance of developing a colorectal cancer.
Mhm.
So I figured, well, let's just, I never had cancer. Okay. This is all
Yeah.
preventative. So early detection's, paramount. And, so I had a lot of resources that, my genetic counselor, my GI doctor, my colorectal surgeon,
Mhm.
and my, primary care we've talked about. So I was able to read about it, and I didn't know anybody with this and I didn't have any family history. I'm asymptomatic.
Yeah.
So, I'm starting from scratch here, but
Mhm.
I have to say my 22-year Navy career, my experiences have equipped me to be able to adapt, improvise, and overcome them, which is a mantra for the Marines,
Yeah.
which I work close with them in the Middle East.
Mhm.
And, the other thing I think about is plan for the worst and hope for the best.
Mhm.
And so that's what I did. But my mindset was I tend not to think about things I'm unable to control, such as medical conditions. What I
Mhm.
can control is my positive attitude. And after 6 decades of God's green earth, my positive attitude is probably this far. why change now? And
That's
plus,
really such
humor.
an important perspective.
Well, it comes with they say the older you get, you have you get more wisdom, and
Mhm.
so I did my military experience. So really set my course. I guess you could nautical
Yeah.
terms. It charted. So where this course goes, I just keep in touch with my medical
Mhm.
team, and I keep asking questions. And I
Yeah.
so the thing is, ask your family questions, talk to your medical team. There's
Mhm.
different components to your medical team because you could have a certified genetic counselor, could have a medical geneticist, you're gonna have a GI doctor, you may even
Right.
have an oncology nurse navigator, your primary care, and it wouldn't even hurt to get into the behavioral health,
Mhm.
because there's
Yes.
so many different, there's so many different layers. You take it's like an onion. Take the peel the layers. The first is the
Yeah.
mutation. Then it's going to be the surgery. And as a
Mhm.
result of the surgery, you have an ostomy. Well, then
Mhm.
you're going to have emotional. So behavioral health could be but everybody's gonna approach this differently. Okay.
Right.
And there's one thing I hadn't shared.
Mhm.
I learned a long time ago. There's two things that we have. We have two things in life. We can react
Mhm.
or we can respond. I choose to respond by gathering information so I can make a logical decision
Mhm.
versus by reacting, shoot from the hip and make a rash decision you may later regret. So I um, I did the best I could to educate myself
Mhm.
based on the resources that I was provided, and then with the questions, the communication with my medical team. To this day, 14 years, I've had this ostomy, 14 years, the
Wow.
13th of July, um, in 2012, which was a Friday. I'm not superstitious. And, I still to this day, but then with your ostomy nurses, you got to get in with them as well because they'll help
Mm.
you out. All there's different medical community has so many
Yeah.
different um, areas that help you out. But it's up to the individual. Like I said, I responded
Mhm.
based on, the information that I had read, and it was credible information. And it's just it's been an incredible journey. It continues to
Yeah.
be, and it's just taken off on so many different levels. I mean, 14 years into this, um, but once again, it's the individual
Right.
is they're gonna everybody's approach was gonna be different.
Mhm.
There's no right or wrong approach. It's just a matter of um, getting keeping an open dialogue with your medical team and your family members for support.
Yeah. One thing that really stood out to me while learning about your journey was that your diagnosis came as a surprise. So, I know what we've talked about is you went in expecting a fairly routine colonoscopy. There wasn't a known diagnosis of AFAP in your family. So I imagine hereditary cancer probably wasn't at the top of your mind that day. Do you think you could take us back a bit to that appointment and like when you
Oh,
realized it wasn't going to be routine anymore?
oh yeah, absolutely. I mean, I had no idea what any of this was they were talking about. I had no
Mhm.
history in my family, both sides, no
Mhm.
colon problems. Shockley's are known for heart problems. Thank goodness I've been having I've been having shit since. And I don't have any no colon problems whatsoever. My relatives had one or
Wow.
two polyps when they had the colonoscopy. My parents and my paternal relatives all passed away. I'm the youngest of my siblings, youngest of my first cousins, and
Mhm.
I share all my information with them. Now, when I got right after the colonoscopy, I was 51 and a half years old.
Mhm.
The GI doctor was 70 years old. Okay, 70 years old.
Wow.
And there's a story about that I'll share. But so he found 100 polyps embedded in my colon, rectum, and anus. He suspected that I had a mutation, and
Mhm.
what he said was FAP, because I didn't know how to say it. And he said, "Well," and I was at the VA in Hawaii.
Mhm.
The VA Sparks Montezuma. That's how you I forgot how to pronounce it. The Pacific Islands VA healthcare system is on the same campus as Triple Iron Medical Center, the flagship
Mhm.
hospital for the military in the Pacific Theater. So he immediately got me referred. to a certified genetic counselor
Mhm.
in Tripler. Now, Tripler only, I mean, Hawaii, the whole state of Hawaii only has at that time, five certified genetic counselors, and one
Wow.
of them was assigned to Tripler. And she actually started in Stanford many years earlier.
Mhm.
There's another story behind that. So all these backstories, no pun
Yeah.
intended, all GI stuff, right? Okay. Uh, Hey, humor is the best way to get through this, you know. So,
Yes.
so I said, well, what are you talking about? What's going on here? So like I said, I had time to read about it and then, so what we're gonna do, you know, I was in the exam room and um, my genetic counselor, Susan, she said, well, what we're gonna do is we're gonna do a blood and saliva sample for DNA.
Mhm.
And then I'm going to bring in a colorectal surgeon. I said, okay, well, where do I need to go for the lab? She goes, no, you just sit right there. The nurse is coming in. So she drew my blood, did a saliva
Mhm.
sample, and then she brought in a colorectal surgeon. We went through everything and said, now we don't know until the results come back. The
Right.
closest molecular oncology lab is in Pasadena, California. It's going to take about 3 weeks to get the results back.
Yeah.
I said, okay, what, you know, so the colorectal surgeon, he came in and he sat down with me and he drew some diagrams and stuff and said, well, this is what, if you had the mutation, this is what we would have to do.
Mhm.
However, I'm going to tell you, Daniel, I'm going to be honest with you. Your case is too complex for me. I'm going to turn you over to the chief colorectal surgeon, Dr. Ronald Gagliano. At the time, he was a lieutenant colonel in the Army, board
Mhm.
certified by a Mayo Clinic. And he took, you know, he did my total proctoclectomy of permanent ileostomy surgery.
Mhm.
And so I appreciate the honesty of my medical team, and I had enough information that I had read about from credible
Mhm.
resources that I could respond by making a logical decision.
Yeah.
And like I said, to this day, I keep asking questions. So
Mm.
a lot of
Such a good quality
unknowns.
to have. Yeah.
Yeah, yeah,
And
absolutely. But I mean, the VA started this because it
mhm.
was just my first and only colonoscopy. And
Yeah.
just go in. I mean, I've always heard, you know, growing up, get a colonoscopy when you turn 50. And of course, you know, I did that. I mean, when I had my
Yeah.
first appointment with my primary care doctor at the VA when I registered, the first thing I was asked was, okay, we recommend you have a colonoscopy at 50. I said, sure, put it. I was 43. He said, put it on my chart. I'll do it.
Mhm.
And I did it. And here we are, you know, with the results. But I'm asymptomatic. I had no idea. And by the
You
way,
never would have known if you didn't do that routine screening.
well, the thing is that genetic testing was key because if I would have done the fit, the infit, those other things, you know,
Mhm.
other tests, I had no blood in my stool. Okay,
Yeah, which
so
you
the
normally
genetic
would.
testing, you have to get into the where the mutation, and if, you know,
Mhm.
the fifth chromosome is where we found it. So
Yeah.
yeah, it's just it's all in the importance of preventative, anything
Mhm.
preventative, you know, just like in
Right.
the military, we have to do maintenance on our equipment. It's preventative, you know?
Mhm.
And so, I mean, let's do it. Let's get this. So now my eyes had opened because I had no idea what they were talking about. I couldn't
Mhm.
pronounce majority of the words. I mean, it took me a while. And then I just dove into this, you know, I just like, okay,
Yeah.
this is awesome. I mean, I had a lot of
Have all that
unknowns, but I mean,
information.
yeah, but
And
I had really amazing um, medical, you know, professionals to talk
mhm.
to that knew about this. And I'm just going to say this now. I know we're going to discuss it later in the
Mhm.
interview. Dr. Henry T. Lynch, the founding father of hereditary cancer research, okay, passed away at 91 and a half years old back in June 2nd of 2019.
Mhm.
And is the he's credited with the discovery of attenuate FAP.
Mhm.
Now, I didn't know who he was, and little did I know that my genetic counselor and colorectal surgeon at Tripler had been colleagues of Dr. Lynch through
That's
the decades,
something.
and he was tracking my journey. So guess who shows up in Hawaii 6 months after my surgery? Dr. Henry T. Lynch. And we're outside the University of Hawaii Cancer Center after one of his lectures. My genetic counselor invited me to attend the lecture, introduced me to Dr. Lynch
Mhm.
in private, personally, and come to find out, Dr. Lynch joined the Navy in 1944, dropped out of high school at 16 years old, used a relative's ID card to get in, served for 2 years on active duty in 3 different campaigns. And back in the day on the ships, they had boxing tournaments called
Mm-hmm.
smokers. And he was really good. He was the original Hammer and Hank. Okay. So he got out of the Navy. And remember, he didn't graduate high school. He married his neighborhood sweetheart, Jane. Okay.
Mm-hmm.
And he came home because he was boxing. That was his occupation when he got out of the Navy. And he came home one day and Jane says, Henry, this boxing gig ain't going to cut it. You need to get yourself a profession. So he went to the VA, started working on credits for, college credits. I believe he started studying clinical psychology. Then he
Mm-hmm.
moved into human genetics. And then in the 50s, he became a medical doctor proctologist. And he had a lot of patients he noticed that were passing away of colon cancer. He said, he shared this with me. He suspected that colon cancer may not just be environmental, it may be hereditary.
Mm-hmm.
So he started applying for grants in the early 60s. Now, keep in mind, I was born in November of 60. Okay.
Mm-hmm.
He started applying for grants to do hereditary cancer research. Okay. Well, 19, and they said, they kept denying him. They said, Henry, you're way off. He goes, no, I think I'm on to something. He's a
Wow.
world renowned leader for hereditary cancer research, not just with colorectal cancer, but with BRCA and BRCA2,
Yes.
BRCA1 and BRCA2. Yeah. So, I mean, but his background,
It's
clinical
an amazing
psychology, medical
journey.
genetics. And then he considered me a colleague. And we sat down for an hour and 50 minutes, talking about I had my DNA test with me, results. I had my surgical pathology report, my
Mm-hmm.
discharge summary. And we talked about, with my genetic counselor who was right there and we had a little huddle. Um, and he says, Daniel, you have a unique case of AFAP because I had no history, asymptomatic. He said, you're what we consider de novo. The 1/3
Mm-hmm.
of the
Yes.
diagnosis are de novo. So I'm in that category. He said, now I encourage you to continue with your routine endoscopic surveillance.
Mm-hmm.
Send me your pathology reports. I'll give you my feedback and insight. So I was doing that through the years. And
What a
2018,
resource to have. What a colleague to
oh,
have.
I mean, talk about the best of it. But we're shipmates, we were taking
Yep.
care of each other.
Mm-hmm.
And so when he passed away, because he was taking care of me, I'm going to take care of him by continuing his legacy. I want to be a live case presentation for medical students, in person or virtually, um, educating them from a patient's perspective about attenuated FAP, continuing the legacy of Dr. Lynch on the importance of early detection in hopes of, and prevention in hopes of saving lives.
And
So
so important
I
for us to
had,
have such a
it's
unique
awesome.
perspective
I'm
too.
living in the most perfect time up until he passed away.
Mm-hmm.
So, yeah, I get super excited about this.
Yeah.
And, it's just, it's an honor. I mean, my life is just taking on a whole new meaning. My purpose is, like you said, to educate the medical students
Mm-hmm.
about this. Um, it goes back also to my mantra, which is always forge ahead with a purpose. And that's an epiphany I had about a year or so after my surgery. I just woke up in the middle of the night, and first 2 words in my mind were forge ahead. So I quickly turned on the nightlight, wrote it down on a piece of paper, forge ahead. Then I said, forge ahead with a purpose. And I said, wait, that's FAP. I have AFAP. What am I always doing? Oh, I'm always forging ahead with purpose. There you go. That's it.
It's so
Thanks.
fitting.
It is. It is. And that's my mantra,
Mm-hmm.
and, you know, my mantra is a positive spin on a bleak diagnosis.
Mm-hmm.
And we had Dr. Lynch on board with, sharing my updates with him through the years, and it was just an honor. So now, and at Stanford, I underwent my latest surgery 5 years ago, this past April, and that was a pancreas sparing duodenectomy resection because we found a 3 centimeter adenoma in my jejunum 6 years ago next month. So it was recommended to have this surgery. Um, so I relocated to Northern California to be closer to Palo Alto GI because the director of the clinic there is the only one that can touch me, take care of because there's no lab in Hawaii that can facilitate a single or double point enteroscopy. So come to find out, my GI doctor, the director of the clinic at VA Palo Alto GI clinic, is from 2016 till present. He's faculty at Stanford on loan to the VA. And so he set me up with a pancreatic surgeon at Stanford to do this surgery. And I never had cancer. This is all preventative.
Right.
So now I've been assigned a certified genetic counselor at Stanford. And as a result, I've been a live case presentation for their MS program in human genetics for genetic counseling and their molecular foundations of medicine course. So
Such
there's
an
other
invaluable
opportunities.
resource.
It's awesome. And you know, it's just, I just love sharing, and I always open up. The students, anybody, you know, a medical profession can ask any questions they want. I don't have any boundaries or barriers. That's
Well,
just
no,
the
we
kind of person I am.
appreciate you and appreciate the work you're doing. And actually, for anyone who's new to AFAP, you think you could provide a brief overview of what it is?
Yeah, brief. It's in the fifth chromosome. It's actually the APC mutation, the adenomatous
Mhm,
polyposis coli. So
mhm,
if you're under 50, you'll be diagnosed with FAP if you have
mhm,
the gene mutation. 50 to 55 is the window for AFAP. I was
mhm.
right there in the window. Now, AFAP is a subvariant of FAP. It's an autosomal dominant germline mutation. Okay, so it's a driver gene, and so, but knowing your family history was definitely going to help. However, there's going to be cases that would be de novo, like myself.
Like
So
yourself, yeah.
I always, you know, the recommendation is to have a colonoscopy.
Mhm.
That way, you get in there, you get the biopsies, and then you can, based on the findings,
Right.
initiate conversation with a certified genetic counselor, even a medical geneticist.
Mhm.
And I have, I trusted my medical team,
Mhm.
and it was not just the VA; it was a tripler, and I mean, I had
Yes.
the best of the best. So, but it's yeah, so it's they're gonna. I have all the FAP colleagues I have,
Mhm.
which are all virtual. They're all symptomatic. They all have family history. They're on medication treatment regime.
Mhm.
I'm at the end of the spectrum, not just for that community, however, for my family, is my relatives, and no one knows anything about this. So I share
Mhm.
all my information, and then with my relatives, they can share it with their GI team. I'll
Oh,
share my
that's
information with
great.
anybody, so
Uh-huh.
they can talk to the individual to talk to their family. But it's up to the individual. Okay,
Right.
the
Every
individual
person's
is going to have,
journey is is different and there's no wrong journey, no wrong way. Like whatever's best for the individual.
whatever they feel comfortable with. But
Mhm.
definitely, for me, it was responding versus reacting,
Yes.
so I can make a logical decision.
Mhm.
But that's
Yeah.
just how I approached it, and I still approach it to this day. Now, there's a
Mhm.
lot of unknowns. I
Yes.
go, I mean, I had just April. I was hospitalized for internal bleeding, and come to find out I have a stomach ulcer. It's
Yeah.
not At this point, it's not related to the mutation. It's related to stress because my wife just passed away.
Mm.
However, I'm under the watchful eye of my GI doctor, Palo Alto. I'm 2 hours away, so I can go down. I was there in June. He found blood and traces of blood in my gastric tract. I have to
Mhm.
go back and see him 23rd of September for another surveillance, just to keep track of that. Now,
Yeah.
I go every 2 years for my
Mhm.
single or double point enteroscopy for the mutation itself. And last August, a year ago, next month, I had my last surveillance, and no biopsies were taken for the first time since 2012, my colonoscopy.
Wow. Oh,
Yeah,
that's
that's
something.
awesome.
Oh, that's
That's
really
awesome. So
great.
I like that very much. I
Yeah.
mean, and I have a binder. I don't have it here with me. I have a 3-inch binder. It's
Mhm.
like it's about 130 pages, double sided, of all the photographs of all my surveillance, the pathology reports, the surgical pathology reports for my surgery, and yeah, it's amazing. Now, also the key too was something important I need to share was
Yeah.
of those 100 polyps that they found embedded throughout my colon, rectum, and anus.
Mhm.
Once they did the biopsies on my, they took my colon out. there was one polyp that turned out to be an 8 centimeter high-grade dysplasia tumor.
Wow.
So in the
Mhm.
behind me is actually the surgical pathology images. But put my graphic designer put this uh, um, flyer, banner together for me. He uses my
Yeah, and that's a
backdrop.
unique thing to
And
have. Most people don't have those
well,
images. Very cool.
no, it gets better than that. I have the actual photograph, 2 photographs of the 8 centimeter from in the lab, the pathology. I had the images they took of. I have in my possession the 25 permanent section pathology slides. It took me
Wow.
12 years to get them, but the leading pathologist at Tripler, I was able to get access to them. So I have them in my possession.
That persistence
And
was
I
worth
use,
it for sure.
yeah, and I take them with me, and I frame. I don't have them in. I'm getting ready to move, but I have the images in 8 by 10 frames. So when I get to my new place, I'm gonna put them on the wall. Right now, I use my banner as my backdrop. But
Mhm.
it's just, hey, I'm proud, because
Yeah.
it's a whole new journey for me,
Mhm.
and I look at it this way. When I was in the Navy, I like to sightsee when I go to ports and learn things. Well, now I'm sightseeing with my GI track. Okay, just I have fun with it. It's
Yeah.
kind of,
No,
and
it's
the medical
really neat to
professionals,
see.
the medical community gets a kick out of it.
Mhm.
When I was at Palo Alto, my medical team was Stanford. I had a medical student, a GI fellow from Stanford,
Mhm.
um, a medical, a resident and an intern and their supervisors. And then my binder was on my bed, in the hospital, and they would come in to see me. So the GI fellow and the medical student came back later, and we sat down for a good 45 minutes, and they were going through reading the notes from my
It's
pathology.
amazing to have that much
And it's like,
history with you. I would love to have just someone's full medical history to be able to look through
yeah.
and really see
And I
those
had it
connections.
right. Yeah, I had it right there, so they didn't have to go to a computer. So here it is,
Yeah.
and we had a great time with it. It was a lot of fun, and yeah, just a really interesting experience. And it's just this is my way of giving back because
Yeah.
once again, the medical professionals, well, they're going to have this information for the rest of their careers, the medical careers,
Mhm.
and then when they retire, they're going to be attending consortiums, conferences,
Yes.
conventions, not just locally but globally, and we can do it virtually now. In the last several
It
years.
helps really expand that reach.
It does.
Mhm.
But this is the thing because look at Dr. Lynch back in the
Mhm.
early 60s, back right after I was born. He
Yes.
suspected that hereditary, that colon cancer may not just be environmental, may be hereditary.
Mhm.
Proved everybody in the entire world, medical world, wrong.
Yes.
And now look where we are. So the least I can do, he considered me a colleague, is to continue to
Continue that
share
legacy.
continue the legacy. And I do it with, that photograph of him, Dr. Lynch and I use that on just about as many articles and podcast,
Yeah.
interviews as possible. Because that,
Uh,
that is near and dear to my heart.
mm, well, I'm sure he's watching over now and thankful for what you're doing.
I am thankful for what he did.
Well, and one thing when I'm thinking of that binder and having all that medical history, using it to continue his legacy, using it to help others so they can study the information, I also think about what that could mean for a family. Say if it was something I know where in your case it was de novo most likely, in another family where we might be seeing individuals who are also showing signs of a hereditary colorectal cancer syndrome. And I'm thinking of patients who may have to tell their family if they're the first one when you were at that beginning stage and having to consider how am I going to present this information to my family, what were some of the things that went through your mind and what were those first conversations with your family like?
Well, learning how to um, to pronounce the words was a big thing.
That's a good one.
Um,
Yes.
However, was able to text them and email them so they can, and then give them the resources I had. Yeah,
Mhm.
it was more of a, well, not just what is this, but where did it come from, and then the family didn't know anything about it.
Right.
you know.
So just it was a
And
surprise, kinda came out of the blue.
well, it was a surprise. Yeah, it definitely came out of the blue. However, then I was like, okay,
Mhm.
well, this is what I have. It's confirmed,
Yep.
and that's I was just inquisitive. I just kept asking. To this day, I keep asking
Yeah.
questions, you know. And Dr. Lynch shared with me
Mhm.
that he estimates that less than 0.03% of the global population are impacted by AFAP. Now,
That's
there's
great.
no documentation. I've talked to medical students, medical professionals
Mhm.
globally. There's no document, there's no peer reviewed publication with that figure in it. I said, well, Dr. Lynch shared that with me.
Mhm.
And so my
Yeah.
hopes are by my efforts educating medical students as many as I can,
Mhm.
that in decades to come, we'll have statistics on it.
Yes.
And, but it's just, it's an amazing journey, but I'm looking forward to learning more about this, and
Mhm.
more importantly, looking forward to sharing my journey with the medical students, because it's a rare disease. APC is the mutation itself, and
Mhm.
FAP and AFAP, based on your age, they're listed. They're one of the 7,100 rare diseases, you
Mhm.
know, globally now. This isn't national. This is global.
Locally.
So
Mhm.
and so think of, if I go back often and think about the genetic counselors and how many different types they have. There's so many
Right.
different types of genetic counselors, and there's
Mhm.
specifically one that I like to work with are the hereditary cancer, arena.
Mhm.
How many um, diseases, like say over 7,100 rare diseases, and then there's different levels of that, you know.
Yes.
And by the way, I had three rare diseases, not just the APC in my fifth chromosome. I have CLCN1 neurological mutation in my seventh chromosome, and I have schwannomatosis in my 22nd chromosome. Now, those two, the latter two, are not cancer um, related. However, they could impact my neurological system.
Mhm. I mean, that's
So,
something I see your moniker is very fitting. Having,
I just, and I made that when I had two mutations.
Mhm.
They're the world's most interesting man of mutations because it was oral. Now I've got third, third
Yes.
time's a charm. So, and, but I have fun with it. Yeah. I have
Mhm.
to have fun. Take a negative, turn it into a positive, you know,
Yes.
as
Well,
the
I was
old expression,
wondering.
mind
Oh, go
over
ahead.
matter. And,
Mhm.
the way I look at it, if I don't mind, it doesn't matter.
Hey, it's a good outlook, though. It was making me think, like, when you found out about all of these, variations, was there an adjustment that happened? Like, what did it look like? I'm sure it was different with each one that you found out about.
Well, we're talking psychological.
Yes.
I just dug into it even more. I'm like, "Oh, what
Mhm.
is," and my medical team, and the other reason my binder is only for the AFAP. I haven't even made
Mhm.
a binder for CLCN1 and schwannomatosis.
Mhm.
Um, I'm having tests done. I've had tests
Yeah.
done, so we know I don't have any schwannomas in my brain, my spine, and
Mhm.
I was just funny 'cause when I had the MRI done last year and
Uh-huh.
this year, and my neuromuscular doctor would call me up and says, "Well, Daniel, the results came back unimpressed." And I said, "See, there's nothing there. I've been telling people that for decades." Um, so yeah, that's a good thing because the
Yeah.
brain's very important for the
Mhm.
schwannoma
Right.
arena. So I
And
don't have
and
any schwannomas on the,
that's good. We wanna keep nothing up there. So
yeah,
let's
and I don't
hold.
have. I had ultrasound of my heart, so they ruled out
Yes.
my heart's fine,
Good.
and and I had a monitor earlier this year, and
Mhm.
everything. Those results came back, so the heart's good. Um, and we're doing. There's a couple more tests, but the thing is, uh, pertaining to the schwannomatosis
Mhm.
and the CLCN1. Now, it's interesting with the CLCN1. I'm listed as having Thompson disease, which is latter in life, versus I think Beckett is the one from earlier onset.
Mhm.
Um, I'm symptomatic for that, and what, and I'm still trying to understand because I hear the term myotonia congenita, and that
Yeah.
is my muscles after being active, they don't relax. So like
Mhm.
right now, if I were to get up and start walking fast, I would probably fall flat on my face. Well, my neuromuscular doctor and my medical geneticist at the VA San Francisco, we
Mhm.
have virtual calls. Earlier, like last year, they suspected that because I got hurt in the Middle East. I had 3 herniated discs, and that was back in 2002. But through
Mhm.
the years, it just keeps I'm my own pain in the neck. Okay, so have fun with that. And so my neuromuscular doctor and medical geneticist said, this neck, it's all muscular.
Mhm.
I wonder if there's a gene mutation that has a direct correlation to your cervical strain. And sure enough, CLCN1 is. And once again, medical technology continue to
Yes.
advance. Now, my neuromuscular doctor, the VA here in French Camp in Stockton, she
Mhm.
came out here a couple years ago from UMass. She did her internship a couple decades ago at Harvard. So she's like, "Well, I've never had I believe she said she's never had a patient with this. Definitely has never had a patient with 3 mutations." And
I've not seen that personally either, so
yeah. And I guess 2 mutations isn't that uncommon.
Mhm.
Um, but,
Yeah, that's the one thing.
anyway,
We
so
all have mutations, we all have variations, but most of those variations don't actually cause any, change to how our body functions. But the fact that you've had 3 where they do impact how our body functions is something that we don't see very often.
yeah. And I mean, the medical technology, genetic testing is very important. Um
Mhm.
And I have a very open dialogue, with my genetic counselor, specifically for the live case presentation part, because how
Yes.
many, how many, medical students are going to read about this? Well, I
Mhm.
want them to read about me, and they get to know me, and
Yeah.
they can take this for the rest of their medical careers. I mean, the medical students at Stanford, they were pretty much all international, 90 of them.
Wow.
And then they had and Genetic Counselor Appreciation Day, if I'm not mistaken, is November 14th every year. That started back in 2017.
Mhm.
So guess I was a guest at Stanford Genetic Counselor Appreciation Day, November 13th last year, and there were two live. I mean, there were two um, live case presentations. One was a virtual. I was in person,
I'm sure
and
that
there
made a
was
big difference in there
well,
and
yeah, and I enjoy that. And I always have my local paper do articles because I want to promote that. And then there's another side to that on the legislative side we can talk about later. But
Mhm.
I enjoy that. So I got down there and I hired my own driver. I don't drive anymore because I don't have full range of motion. But I hired
Mhm.
my own driver to take me down there and and I invited him to come in and stay for the
Mhm.
lecture or the presentation. And then they had a taco. They ordered their own. They had a taco bar there in the classroom, and we were eating tacos and had cake and cookies and just
Oh, it
having
sounds
a.
so fun.
It is, and come to find out that there were 10 faculty members, and one of those faculty members is a personal friend of my genetic counselor in Hawaii who's retired now because Susan
Wow,
started
small
at
world.
Stanford many decades ago. So we got a picture together and I said, "Hey, text this to Susan and say, hey, you'll never guess who showed up on campus today at Stanford." And we just had a blast. And I keep Susan, I text her. She's she's retired and she's on the Big Island growing coffee.
Oh, very nice.
Talk about a great coffee break. But, no, I have fun with this, and I keep I mean, it's just an amazing journey. I mean, once again, it's, take a negative, turn into a positive.
Mhm.
But,
Well,
But yeah,
I'm
it's
also curious about that with the medical care. What was it like, and how did you keep turning that negative into a positive with the changes to you physically? Like, what did that look like, especially during those first several months?
well, I mean, I lost a lot of weight from my both surgeries.
Mhm.
Um, but I kept my mind busy. That was very, very important. Keep your mind busy.
Mhm.
So I just had, I mean, I was 9 weeks on short-term disability because I had um,
Yeah.
the incision on the front of my abdominal vertical was like 35 staples. And where my anus used to be with 13 staples. So I'm 6'1". So I just let my body recover
Mhm.
from the surgery. But
Yeah.
my stoma was working.
Mhm.
I had my ostomy nurse to equip me to be self-sufficient, which I am to this day. And I have a very open dialogue with my ostomy nurse in the wound clinic at the VA. I offer
Mhm.
my if you need somebody to come in, you want to train some of your nurses,
Mhm.
I'll be more than happy to come in. They can. I'm your guy. I'm your ostomate.
No,
And
you have some long journey, a lot of experience now, I'm sure.
I do. But I'm learning as I go. But the thing
Yeah.
is, it's all about because everybody's going to be different. Medical professionals are dealing or tending to patients
Yes.
and their family members, and you know, it's what are they thinking? But so I want to be on the other side as a patient. You
Yeah.
know, to share that. How to. This is what afforded me the opportunity to overcome adversity.
Mhm.
Plan for the worst, hope for the best, but
Yeah.
prepare yourself by reading credible resources, and talking to your medical community. Um, that way, and I get to educate them
Mhm.
because a lot of them, I mean, over 90% of them, uh, have never had a patient with this mutation,
Right.
or probably with any of these mutations. I mean, take your
Mhm.
pick.
Yeah.
We have conversations about so many different, different level, different layers to this.
Mhm.
I always, I'm enjoying it. It gets frustrating at
Yeah.
times. Only now recently because I'm symptomatic, but that's not
Mhm.
related to this. So I need to stay the course. That's just a distraction, right? I need to stay the course.
Mhm.
And so then, being a guest on various podcasts,
Yeah.
webinars, interactive cases, that keeps me going as well.
Well, I'm so glad that you've found this outlet. And it's not only, you're helping others by doing this as well. You've really taken this situation that is quite difficult and turned it into something so meaningful and helpful for others. And again, I really can't thank you enough for that.
Well, I appreciate the kind words. I send out positive vibes and I get it back tenfold. So this is actually helping me out. It helps me get over, I mean, I like to, just to, I think of myself as a positive person. I do have my moments, but for the most part, I mean, look at the importance. Going back to what Dr. Lynch,
Mhm.
look at the importance. I mean, even going back further, no, February 28th of 1953, what historic event took place? Crick and
Uh,
Watson
yes.
discovered the DNA double helix at the Eagle Cafe in Cambridge, which is still there today. There's a plaque outside. I've never been there. I'd like to go there. But Crick and Watson, okay?
Yeah.
And so then, not probably a decade later, Dr. Lynch is doing hereditary cancer research. I
Mhm.
mean, there's a lot of things. So medical technology, I mean, if you go back even further, just genetics, Gregor Mendel, what,
Mhm. With the peas.
1856? Giving peas a chance since 1856. I mean, that's, I look at this. So who knows decades from now where we're going to be with the APC, whether it be FAP or APC, I
Mhm.
mean AFAP, with the preventative care,
Right. Well,
all about
thinking of that
prevention.
preventative care, I know a diagnosis of AFAP often means that that lifelong surveillance, your regular colonoscopies, and, well, at least before you have your surgery, upper endoscopies, appointments, tests. And one question I actually came across repeatedly while preparing for today was, does life eventually start feeling quote unquote normal, or what does that look like, and what adjusting to this routine may look like? How would you say that felt for you, and when did it start to feel like there's a sense of normalcy, a routine, and
Well, I'm not your average patient. Definitely not your average guy, because I like to talk about this. But I once again, I continue to ask questions. So
yeah.
I want a captive audience with my GI doctor, my primary care, my genetic counselor, both of the VA and Stanford, and my
Mhm,
medical geneticist. But now we've got for my medical geneticist, my genetic counselors, I
mhm,
have to figure out, we have to figure out which mutation we're going to talk about. With the GI, it's real easy. But I
mhm,
keep asking questions. My pancreatic surgeon at Stanford, I had a visit with him right before Christmas of last year. He goes,
mhm.
Daniel, and by the way, I put on 50 pounds since my surgery. I'm up to 192 pounds. I was actually up at one time. I was up to 202. Well, I'm
That's a
6'1",
big
so
switch. It
but I
fits.
need it. Yeah, it fits. And so I'm down to 192, which is fine. But I've never been bigger, never been more than 185,
Mhm,
180. And so, um, my surgeon, he says, Daniel, do you keep up with your surveillance? And
mhm.
you're going to live to be an old man. I said, Doc, I just turned 65. I'm already halfway there. Besides, I already knew that. I just needed a second opinion. But you see, it gets back into that like Don Rickles.
Yes.
Just the wit, and it's just quick. And we had the biggest laugh about that. And, but I consider my endoscopic surveillance routine. It's just
Mhm.
like, I mean, I enjoy it. I really do.
Is it
I
something
mean,
that's always felt that way for you, or is it something that took some time to get to this point?
no, it
Yeah.
didn't take time at all. I mean,
Yeah.
I was locked in.
You're ready to
I'm a
go.
different breed. I'm a
Yeah.
different breed.
I
It's
think
got to
that
be my
Navy
medical.
background too.
Yeah, yeah. And yeah, it's definitely the Navy because, when we deploy, we have to go through pre-overseas movement training and things like that. So,
Yeah.
and 4 ships, the 7 ships I was on, 3 of them were deployed to the Persian Gulf at different times. So, you
Mhm,
know, um, once again, plan for the worst, hope for the best, adapt, improvise, and overcome. And so, but I considered my AFAP journey for me personally being
mhm,
normal going in for my surveillance
mhm.
only because I've been asymptomatic.
Yeah.
I mean, not only, but I mean, my mindset, my, emotional, psychological, I mean, the ostomy is a whole different, I'm fine with that too. But
Mhm.
once again, I'm open to the learning about this and I'm not afraid to talk about, sharing my experience
Yeah.
uh, but I really do. I literally, but, however, I can't say the word but however, having the opportunity to know Dr. Lynch and be him be consider me a colleague, that was like the ultimate.
I
In
was gonna say
fact, my
that's such a
life is
unique experience.
it's beyond. I mean, I think I asked my medical professionals, medical students, have you ever heard of a patient diagnosed with a mutation where they had a captive audience with that doctor, and I mean, so I just keep going, just keep.
Yeah.
I can't explain that part. There'll be an epiphany I have with that, what I'm sharing with you right now. But
You're right.
and that's the other thing. What's that old? What's the old quote by Picasso? Inspiration has to find you working. So, and I don't work, so but I mean, so but I enjoy it. I mean, so I considered my life normal. You
Mhm.
know, this is, I don't know, would I say it's the new normal? I guess you can say it's the new normal. I could say it's the new normal.
Mhm.
And, but once again, I've adjusted,
Right.
adapted. So there's an acronym I created for the word adapt. Attitude determines the ability for a positive transformation.
Mhm.
And that, that was another epiphany,
Yeah.
you know? Um,
Is that something
so
that you had prior to surgery? Because I know a lot of people ask another question that pops up for me a lot is this uncertainty around surgery. And for a lot of people, that's one of the biggest fears they have after being diagnosed. And I know, from what I know about your journey, speaking to you. It wasn't a decision you took lightly, but as you said, you chose to respond. Did you have this adapt perspective when you were uh, coming to the decision to have surgery? What was that like for you?
Well, once again, it was uncharted territory.
Yeah.
However, the material, the resources that I was reading, and my
Mhm.
discussions with my GI doctor, especially my genetic counselor, my colorectal surgeon, and this was before I even knew about Dr. Lynch. Um,
Mhm.
so there was 6 weeks that I was reading, and then the chief of surgery and the leading pathologist at Trip were a husband and wife. So I was, I got to know them very well
Yeah.
about this journey. So it all helped out big
Mhm.
time. But however, I keep saying, but however, the most important thing was my mind was I kept an open mind,
Yeah.
and it was challenging.
Mhm.
However, I don't look at this as an obstacle. I
Mhm.
look at it as an opportunity to overcome adversity. And so, there. However, everybody's journey, their diagnosis and their after post-diagnosis is going to be different.
Yeah.
Now that's where I'm at. I'm 14 years into this. I'm not that as a this diagnosis and having an ostomy. I'm not really that far along in my journey compared to other ostomates that I know. I'm
Mhm.
51 when I started this journey. I have individuals with the mutation that have been going through colonoscopy since before they were even in their teens,
Right.
and they're symptomatic and on treatment regime, and
Mhm.
I'm at the other end of the spectrum, and
Yeah.
I just want to keep that course,
Mhm.
and but however, it's just a matter of I just keep asking questions. I mean, I can't
Yeah.
say that enough. But, everybody. Um, Once again, a lot of people are going to react.
Mhm.
There are times that I reacted. I mean, I'm human.
Yeah,
However, then
human.
I just like, okay, think back, think back.
Mhm.
What was I when I was deployed?
Mhm.
Whether it be in the Indian Ocean, or the Eastern Pacific, Western Pacific, South China Sea. Um, you know, then I look back and say, wait a minute, I was in the Persian Gulf. What do we always hear about that? Well, lots of uncertainty. Only one way in, only one way out.
Mhm.
And so I was
Yeah, it
like,
really
okay,
prepared
I'm
you.
just that's just that helped calm the waters.
Mhm.
I'll get into nautical stuff, but it just yeah, smooth
Yeah.
sailing. Well, for the most part. But hey, what's that old expression about what was about the smooth water didn't help the wind. You have to have wind for a
Mhm.
sail. I mean, real deal. You know what I'm saying?
Yeah,
I
like
don't know
that.
that phrase,
I
but
know what you're getting at, though.
yeah, yeah. So smooth sailing didn't. What was it about to equip the sail? It was
Yeah,
had
'cause
to
you need
adjust to the
wind for
wind.
that boat to
The sail, the sail.
yep, the sail to
Back in the
actually.
day, that yeah, yeah. So
Well, I know
and
one thing I know you mentioned that how the journey can differ for many people and, different ostomates, and one thing, like, I've really admired about your advocacy is how you've been willing to talk openly about many of your experiences. I was wondering if you could talk a little bit about what it's like living with an ileostomy and what life as an ostomate is like, especially for those, patients who may be listening that are making that decision to have surgery.
yeah, um it's an interesting way of life.
Mhm.
Um and it's different obviously, but you just once again you just be able to that's where the adapt attitude determines the ability for a positive transformation because your
Mhm.
body has to transform. Now keep in mind the ostomates, you could have temporary surgery, you
Mhm.
could have a scheduled surgery. Your surgery could be permanent or it could be temporary.
Mhm.
So mine was planned, mine was permanent. So right away, I just put aside the temporary and the unplanned surgery,
Mhm.
emergency surgery for injury.
Yeah.
Um, so then I was able to focus, but it's just a matter of looking my research, what I was at, where
Mhm.
my journey was at. I was at, okay, I have the mutation, and we know it's in the best practice of medicine to have a total proctoclectomy with permeable ostomy surgery, because any of those polyps left unattended have a 100% chance of developing a colorectal cancer. Well, I already knew, okay, if I'm gonna have the mutation, then I want the surgery.
Mhm.
And so when I was informed by my colorectal surgeon on 29th of June of 2012, which was a Friday,
Mhm.
he said, Daniel, and my genetic counselor was there as well. He said, you have the mutation. And I said, okay. He goes, well, it's in the best practice medicine of mutation of the surgery. I said, you don't need this. You don't have to have the surgery, but you need it, because the longer you wait, the higher percentage any of those polyps could turn into 100%, colorectal cancer. I said, well, I want the surgery. Dr. Gagliano looks at me and goes, Daniel, that's what I thought you'd say. I've already scheduled your surgery. It's 2 weeks from today. And I said, okay, let's do it. And,
Love that.
and yeah, so, I woke up from the surgery and, I knew where I was. I started asking questions, and I had like handful of nurses in the recovery room,
Mhm.
and, I was pulled because,
Yeah.
you I mean, the surgery took a lot, no pun intended, it took a lot out of me. So they put a towel, they wrapped a blanket around my head.
Oh, wow. Well, that's one way to warm
Well,
you up.
yeah. And then, so they brought me up to in the recovery, brought me up to the ward, and they had all 7 charge nurses around my bed. And, that was a there was
That's quite a
because I
big
was
team there.
well, it's because they wanted all the nurses, the charge nurses, to be, I believe that's what they called them, referred to
Mhm.
them. They had different names these days, but
Yeah.
they were all around my bed because they were, given instructions about my case,
Mhm.
my surgery, and then they
Right, because most
also
of them
nurse
would have not seen a patient with, the AFAP,
well,
where it's, like, not common.
they definitely didn't see a patient with it, but with the magnitude of the surgery of 35
Right.
staples midline and 13 where my anus used to be, and I'm
Mhm.
sleeping on the bed sideways because my feet were hanging off at a
Mm,
45-degree angle.
yes.
You know, yeah, it's just, yeah, it's very, very, I would be eye-opening, but the thing is,
Mhm.
I was open to this.
Mhm.
I kept an open mind to the best of my ability. I mean, like I
Mhm.
said, I do have challenges.
Yeah.
The the more that I read, but I had, plus after getting to meet Dr. Lynch, I was like, okay, this is the calming that I've been looking.
Yeah.
I never expected it. I mean,
Mhm.
I appreciated that to this day,
Mhm.
and that just gave me the the that reinforced my ability to be so resilient, I guess you could
Yeah.
say.
Well, I know you mentioned a lot about this team that you had surrounding you, including Dr. Lynch, your genetic counselor. I was wondering if we could focus a bit on your genetic counseling experience and what made your genetic counselor helpful to you. What's something that you would want future genetic counselors to know, and how they interacting with their patient, what could be helpful?
Well, my genetic counselor, I've never had an opportunity to meet one. I didn't even know what they were.
Hmm.
This is all new to me. So I went in there. She asked me lots of questions, and we went through, different things and about the mutation that she suspected based on the 100 polyps embedded through my colorectal anus. So
Hmm.
we didn't know because I was asymptomatic,
Yeah.
and I was like, okay, I need to know what this is. What am I doing? And
Hmm.
yeah, it was I mean, I had an open door, open communication with them, and kept asking questions
Hmm.
every opportunity, because I was doing my own research, at night, and continue to talk to her. But the way she went through everything, I mean, I didn't know at the time that the certified genetic counselors, there's so many different ones. She
Hmm.
was at that time specifically a hereditary cancer
Yes.
arena. So, but I didn't know anything about it. I mean, that's how I keep saying,
Yeah, most people haven't heard of a genetic counselor, so it makes sense.
you know. But I had an open discussion with her. She was asking questions, and
Mhm.
um, so once we did the DNA test, that was only a week after my colonoscopy. And
Mhm.
then in the following days, as I'm reading information, I find out that supernumerary teeth are directly related to the APC mutation. So I
Mm.
went back to see my genetic counselor and I said, in 1972, I had supernumerary teeth. I had 7 teeth where one was supposed to be. And she goes, "Oh, well, you never mentioned that." So I didn't know about it. I was reading the resources and I came across it. So I'm thinking that was in 1972. That's Dr. Lynch did his research in 1984, which 1992 led to the discovery of AFAP.
Yes,
But
yes.
I was like, well, what we were known, would we have known back then?
Mhm.
So now for the future, there's different things, and I like to share that, and as well as CHRPY, congenital hypertrophy retinal
Yes.
pigmentation of the epithelium. I have elliptical lesions in both eyes, so that's directly related to the APC mutation. So these are things I like to share with the
Mhm.
medical students, specifically the genetic counseling medical students, because supernumerary teeth, CHRPY, and have an APC mutation. Now, there's no cure for CHRPY. I mean, there's no cure for APC.
Mhm.
It's just a matter of surveillance. Now, in my case, um, we just go in and start removing things. So I had my colorectal taken out
Mhm.
back in 2012. And in 2021, we had 60 centimeters on my duodenum or duodenum, depends on who you talk to, what day of the week it is.
Mhm.
I had my gallbladder removed, and then my pancreatic bile duct um, what did they do? What was it? What's the term? Resection, I think it was.
Oh, yes,
And they
yes.
and he inserted a 5 French pancreatic stent. And I only found out about because I had the operative notes. And then I asked them
Nice.
later on about the 5 French pancreatic stent, how long that'd be there, if that's going to be there. And he goes, "Oh, that dissolved about 5, 6 weeks later." Okay. Well, that's good to know when I have to have MRIs because of a stent. You think of it's
Yes. The
metal, right?
metal.
Well, yeah. So I had the operative note and I gave it to my MRI tech. They entered in my and then when I talked to my surgeon back in December, he goes, "Oh no, that 5 French pancreatic stent that dissolved." So
Mhm.
okay, that's good to know.
No, yeah, that's
I can learn
definitely
of that
important.
too.
It really shows
Yeah.
that importance of staying curious, asking those questions, and I think that's something
Oh,
that you've really had throughout that journey.
well, I've done that in life in general. I go to
Mhm.
different make sport business. When I travel, I want to enjoy the sights, the sounds.
Yeah.
I want to learn the customs, the cultures, the courtesies, the cuisine. Oh my gosh, you know,
Mhm.
and just have fun with it. All the
Yeah.
countries I've gone to, just try to sit down with some locals and just, and then here in where I'm in Northern California, I have a lot of individuals that I can talk to from all different ethnicities. It's incredible. Hawaii was great too because it's a melting pot for the Pacific. But over here, I'm finding, especially my little town here, um,
Mhm.
the different the backgrounds, and then in the area itself, my medical team, they're very diverse. It's just
Yeah.
incredible, and we have a good we have good discussions, whichever the appointment is, whether it's neuromuscular. I've got a dermatologist checking for my schwannomas, of course, my GI doctor, my ostomy nurse. I mean, there's just so many different levels to it.
Right.
But I enjoy it.
Mhm.
That's just me.
Yeah.
But,
And well, I know that we focus a lot on navigating life with AP, but somewhere along the way, you made that decision that you wanted to make a difference for the next person who received the diagnosis for the field. And so this is kind of where I want to take our conversation next. If you could sit down with every healthcare provider who's about to meet a newly diagnosed AFAP patient, what's the first thing you'd want them to know as an advocate, as a patient?
well, in my eyes, I would suggest that they learn the history of
Mhm.
AFAP. With Dr. Lynch and his research, and where it's gone from there.
Mhm.
Um, you know, um, just a side thought, my GI doctor was 70 years old, if I had mentioned this before.
Mhm.
So after my surgery, I had an opportunity to talk to him. And he goes, Daniel, I was going to retire 6 years ago. And I said, well, Doc, you know why you didn't retire? Because you needed to save my life. And we had a big laugh about it. But, it's just, um, it's, what's the old, there's a, not old expression, there's a new expression for that the Global Colorectal Cancer Association came up with earlier this year or
Mhm.
last fall. As they call it, knowing is worth the wait. And I was selected to be an ambassador for their campaign at the American Society of Clinical Oncology conference in San Francisco. And we did it. They interviewed me last. The director of Global Colon Cancer Association interviewed me last fall
Mhm.
for that convention in earlier January this year. And the campaign, like I said, no one is worth the wait. So, I mean, I'm just I'm just thankful that everything turned out the way that it did, you
Yeah.
know. And I'm honored to be, a spokesperson for the rare disease community. Well,
Mhm.
because I had three of them, the
Yeah.
AFAP, community, the ostomy, um, what else is there? Men's mental health. I mean, but there's so many different layers to this journey. But
Yeah.
my I gotta say my attitude, definitely pushing me through, asking and being curious,
Mhm. That really makes me think of that motto again, always forge ahead with a purpose, you know?
That's it. Yeah. I mean, I have my days, but I mean, for the
Yeah.
most part, if I get, if I just focus,
Mhm.
I mean, there were epiphanies, adapt. It was another epiphany. And so, um, it's not, the attitude determines the ability for a positive transformation. So it's not just something that's an acronym that I made up. It's an epiphany I had, but
Yeah.
it's actually the way, just like always forge ahead with a purpose
Mhm.
is, now I don't know if you know this, but if you take the first letters of each of those words, what's it spell? Always forge ahead with a purpose. Spells
AFAP.
AFAP. Hey, if it was meant to be.
Meant to
So,
be.
yeah. So, but I have fun with it. But like I
Mhm.
said, everybody, it's just if I send out positive vibes, you get it back, tenfold. If
Yeah.
if I share by my sharing, or whoever hears or reads about it, if that um you know um resonates with them,
Mhm.
um or their family or friends, I mean,
Yeah.
definitely that's awesome. But I feed off of what others. I always love going into an audience. I always love an audience of medical students, and I just like the Molecular Foundations of Medicine course was a 2-hour course. The professor, she she opened it up, did a quick introduction,
Mhm.
and she had a 24 slide presentation. The first 5, 6 slides were hers, and then little did I know from the previous month, all my emails, I had
Uh-huh.
all my live case presentations, virtual letters of acknowledgement, all my DNA tests, pathology. Um, she had that as a flight deck. So I had the class for an hour and 50 minutes, and
Wow.
I said, ask any questions you want. I have no boundaries, no barriers. I was asked all kinds of questions from medical students from all over the world. It was incredible. I don't know who was having more fun, me or them, because it wasn't a really, I mean, the class was kind of like a field trip for them,
Oh, yeah.
and because they get to see a patient who's got the mutation, who's
Yes.
had, the surgery, is a permanent ostomate, and then they can ask me questions. So they didn't. And it's funny because my driver was sitting in the back of the class because it was like a theater, the classroom.
Mhm.
I was down in the pit.
Oh, yes.
My driver was sitting in behind the last row, and all the students had their laptops. And he said that there were students that were fact checking me while I was talking. And it was like, it was like awesome. I was like, he told me on the way home. I was like, I didn't, I'm up there just like I'm living, loving this, just
Yeah.
because. I mean, how many times do medical students, along with medical professionals, how many times do they have an opportunity to hear a patient's perspective? You know,
So true.
right in person. Not, you know, you hear about them, you read about them possibly, but and then to have direct ties with Dr. Lynch. I
Mhm.
mean,
Oh,
just
yeah. Well, I really wanted
awesome.
to come back to that relationship too.
Yeah,
I know, most of us, our students, we know him as the father of hereditary cancer genetics, but I mean, you knew him as a mentor, a friend, and I
yeah.
just wanted to hear a little bit more about that relationship. That's is something so special there.
Well, yeah, we communicated via email every year from 2013 through the fall of 20. It's always the fall of 2018 or the fall of every year is when I had my surveillance.
Mhm.
And he would say, "Okay, there's nothing to be alarmed about. This is typical with the mutation. Just continue surveillance. Continue to send me your pathology." And
Mhm.
you know, he shared with me there's not a lot of information out there about it. So I said,
Yeah.
well, and and also early on, I was collaborating with the Colon Cancer Alliance and the United Ostomy Associations of America, along with Colon Cancer um, Coalition and a few others. The Colon Cancer Prevention Project. I've been collaborating with them for several years as well.
Mhm.
So I was invited by the UOAA and the Colon Cancer Alliance. I was invited to seek legislative support for proclamation. And in the future, it was the rare disease community as well.
Mhm.
So um, Ostomy Awareness Day is the first Saturday of every October,
Mhm.
and so I would get the wording for that proclamation, and I've had governors present the proclamation for that, as well as we even did colorectal cancer awareness month in March, and then Rare Disease Day is the last day of February.
Uh-huh.
And recently, um, I piggybacked with my two FAP colleagues in the Midwest who had started a FAP awareness campaign the third week of every June. They've been doing that since 2017. Well, I piggyback on that when they're beginning their the governors to issue proclamations.
Mhm.
So um, I thought the best way that I could support those campaigns here in California is to have my local senator, um, Roger Neal. I reside in his district, to author Senate concurrent resolutions. And so we've had that for Ostomy Awareness Day,
Mhm.
FAP awareness. In fact, we just did a Senate resolution for FAP Awareness Week last month. So I'll be getting that framed. And I have all the framed resolutions. So when I get to my new place, I have all. There's like 6 of them.
Wow.
And then earlier or last fall, I asked Senator Neal if he would be interested in authoring a rare disease um, Senate concurrent resolution because I had three. Well, no, I had two at that time. I didn't have three till this year. But
Mhm.
so he said, well, I'll. There's an assemblywoman, Diane Dixon, down in Newport Beach,
Mhm.
and she is authoring. She's part of the Rare Disease Caucus here in California. She's already authoring a assembly concurrent resolution. I will co-author it, and so I contacted her staff, and they sent me the assembly concurrent resolution, uh, that framed copy that passed on February 23rd. And I was
Mhm.
actually going to be at the Capitol, but I got a few things going on and I didn't make it here.
Mhm.
I'm just below Sacramento. So I'm hoping next year I'll go.
Yeah,
And
that would be neat.
yeah, so I've got an Assembly concurrent resolution and I've got a um, Senate concurrent resolution for colorectal cancer awareness month, FAP awareness week, and then ostomy awareness.
Wow. Is there any accomplishment that you're most proud of? Because I know you've really helped raise awareness, establish things like California's FAP Awareness Week. And so, it's clear again that this advocacy work has been so important. I'm just wondering which of the ones really stand out to you.
Oh, FAP,
Mhm.
definitely. FAP, right up the
Yeah.
top. And then and then the ostomy awareness, and then the rare disease. Only because the FAP is, that's what started my journey, having an ostomy, and then later find out it's a rare disease. So that would be my
Yeah.
top three, definitely. And yeah, it's amazing. So, and Gulf Herald newspaper does the articles, and Senator Nilo, communication director, sends a press release to the paper, and then so I get extra copies of that. Plus, it's online, digital. I can send it, you know, I blast it, virtually to all my colleagues, my fans all over the world. It's just, I enjoy that, but the most important, like I said, is FAP awareness. And if we
Yeah.
can take it to that next level, now even though it's FAP awareness, because AFAP being a subvariant of
It
FAP,
falls in that
FAP
umbrella.
impacts less than 1%. The last I heard. Um,
Wow.
so, and that's enough as it is. But when you got 0.03%, if that is the figure, I mean,
Yeah.
what, 7.5 billion is the population? So what? That would be 267,000 rounded up. That's an estimate. I mean, and that's global. I have colleagues in different countries that have not only read about it, but they have patients with FAP, and so but we're all we're all in this journey together, and now
Yeah.
virtually we can do so many different things, and with the advancements, and we just continue with those medical advancements. I mean, DNA testing. I mean, just alone, in the last half a century, we've come a long way.
We have.
I mean, you always hear about it with the forensic side, but now on the medical side for diagnosis, I mean, it's literally saved my life, you know.
Yeah.
But well, once again, I believe that I feel I'm living in the most perfect time, and the FAP awareness campaign, I want to continue that, different levels, whether it be with my local assembly member, with whoever, whatever other opportunities I'd have.
Yeah.
So I'm doing, I continue to reach out. I'm hoping that to make a bigger impact with the Stanford, School of Medicine, whether it be the MS program in human genetics or genetic counseling, molecular foundations of medicine. I'm trying to get into I offered my services to the my pancreatic surgeon at Stanford. My GI. I'm going to offer my services to Dr. Latterbaum of the GI, my GI doctor there at Stanford at the Digestive Health. Let's do some, not just live case presentations. Let's do some, what's the word? Article for a medical journal. Pick, my neuromuscular doctor wants to do one on schwannomatosis, and I believe she's probably going to incorporate CLCN1. Let's do it.
Yeah. And so, like, I
Because
know you've accomplished so much through this advocacy. And so, as we're talking about this, what do you hope that future looks like for individuals living with AFAP or these other rare variants? I know you've been talking about what you hope um, this advancement of science will look like.
Well, I'm hoping that it's going to calm the waters for the individuals who are diagnosed with it,
Mm-hmm.
or their family members be able to hear from it,
Yeah.
and hoping that it would be able to you know have an impact on their lives. You
Mm-hmm.
know,
Yeah.
and I'm on Instagram and LinkedIn, always available to answer questions. I get contacted various times. There's only an opportunity to connect with you came up. I said,
Yes.
"Oh, I can't pass that up." And then come to find out, we have a Navy background.
Yeah.
Wouldn't because that's how it started with Dr. Lynch. And I mean, well, it didn't start that way, but I
But
want
you've
to give
kept
back.
yourself open to these connections through giving back, through just being curious. It's just
Yeah,
so
it's like,
interesting to see where it's taken you.
yeah, I mean, it's kind of like that old cliche of two ships passing in the night, and
Yes.
you just, and I've been in communications in the Navy for 22 years. So
Mhm.
when I'm on a ship, I'm communicating with a shore station, or other ships. So I just
Mhm.
kept that, but that's just me. I'm wired a lot different, you know.
Mm-hmm.
I'm a guy. I got 3 mutations. I love talking about it. You know, pretty much
Yeah.
that's. I mean, I'll bore people that don't know about it and are not interested in it. I'm just that's social for me. That's talking. You know,
Mm-hmm.
that's
You're just talking about
I,
your life, what you've learned, you know?
well, yeah, the life's experiences, you know, however, it's all back to, you know, always forge ahead with a purpose, and
Mm-hmm.
then taking a negative, turn into a positive, you know, and
Yeah.
um, and it helps. I mean, I get help along the way. You know, I talk to different
Mm-hmm.
people that, you know, different colleagues that have different. I mean, everybody's going to have their ups and their downs, you know, their
Mm-hmm.
peaks and their valleys, their ebbs and their flows. But I just, you know, the old English expression, take it with a pinch of salt.
Yes.
Yeah. So,
Well, as we're
uh,
coming near to the end of this episode, I always like to end with one final question. And so I'm thinking when people finish listening to this episode, what's one thing you hope they remember?
always forge ahead.
Right. Well, Dan, thank you so much for joining me today. I really appreciate that openness and your willingness to share these experiences. And, one thing that's really stood out to me throughout this conversation is that, well, AFAP has certainly shaped your life. It's really helped open to more. It hasn't defined it in the sense of changing where you've closed in, but rather you've opened up to others and used it as this way to help others, and it's just something that's really special. So I know our listeners are going to learn a great deal from hearing your perspective. And, I'm just really grateful you took the time to be here. So thank you again.
Well, thank you, Sam. I appreciate it. Looking forward to sending the finished product out to my colleagues.
Yes, and I'll also include your social media information if
Yeah.
you're okay with that in our video
Absolutely.
description.
Sure. Absolutely.
Well, again, thank you so much. And to everyone who's joined us today for this episode of Ask a Genetic Counselor, thank you as well. If anything in today's conversation resonated with you, or if you know someone who's recently been diagnosed with AFAP or just any other hereditary cancer syndrome, just I hope you'll consider sharing this with them. And know if you have any genetics questions you'd like answered on a future episode, I'd love to hear from you. I'm sure Dan would love to hear from you if you have any questions for him. And so feel free to submit your questions by leaving a comment on this podcast or just reaching out to me or to Dan on any social media platform. So thank you again for being here. And until next time, keep asking those questions and keep staying curious. And I'll see you in the next episode of Ask a Genetic Counselor.
Got questions about your genes or your DNA? Let's find the answers. Ask a genetic counselor.